You are listening to Therapist Unplugged for straight talk on life, relationships, and mental health. I am your host, Laurie Poole, licensed professional counselor with the Montfort Group in North Dallas. Each episode will feature the unplugged views of guests and fellow therapists as we navigate hot topics, therapy trends, and the world around us. Hello, everyone, and welcome to Therapist Unplugged. This is your host, Laurie Poole, and I am so delighted for this episode. Our topic is integrative psychiatry, which is maybe a term that not a lot of our listeners, all 12 of them, are familiar with. Dr. Christian Monsalve came to our office a couple of months ago, I guess it is now, and educated us on his approach to psychiatry. We all got so excited that I invited him to join us for this episode today. And I want to share with you a little bit about his background because he really is a very unique clinician. And Dr. Monsalve, thank you so much for coming and taking the time to talk with us today.
No, Laura, I'm so happy to be here with you and your listeners, and look forward to a lovely conversation.
Yes, absolutely. For our listeners, Dr. Monsalve is a board-certified psychiatrist who specializes in the care of high-functioning individuals with complex and sensitive clinical needs. We're going to talk about that. As founder and medical director of Vera Great Health, his work focuses on precision psychiatry, integrating evidence-based medicine, functional assessment, and disciplined clinical strategy to support long-term stability, cognitive clarity, and oh my God, couldn't we all use some of that? And psychological resilience. His practice is intentionally selective, allowing for depth, continuity, and thoughtful decision-making beyond the constraints of traditional care models. In addition, he is a consultant to the ABC News Medical Unit, and is involved in international academic and advisory activities with recognized contributions in ethics, psychotherapy, and global health. Wow, that is a very impressive resume, sir. I wonder is there anything that you would like to add to that description of your background and your specialty?
Oh, Laurie, thanks so much. Well, that was a very, very generous introduction. I'm also fluent in Spanish, and I see patients across the country right now in 7 states. But
Wow.
Look forward to expanding in the future. Obviously.
Okay. Well, I would love to start with an explanation of what integrative psychiatry involves, because I think in my experience, often when I say to clients, based on what you've shared today, why don't we do some evaluation for depression, for example? And let's see if maybe we can get your baseline to go up a little higher, And it's interesting to see the kinds of reactions that people have. They're skeptical of medications. They're not sure what the difference is between a psychologist and a psychiatrist. Like there's still a lot of unknowns. I think maybe a little suspicion of psychiatry. And so maybe you could share with us what it means to be in integrative psychiatry and how that's different.
Absolutely, yeah. So first we can start that integrative psychiatry respects the foundation, right, of psychiatry, the best of what evidence-based medicine there is. First we have to define that psychiatry, it's an interdisciplinary discipline, but primarily it's a medical discipline subspecialty which focuses on problems of thoughts, moods, and behaviors. Example can include things like substance addictions or other behavioral addictions, right? So it's a broad and fascinating field. And integrative in the sense that it respects maybe the biomedical foundation, but it looks at other things and say, to what extent is nutritional optimization appropriate? To what extent is exercise an appropriate aspect of treatment? To what extent, for the patient for whom it's important, integrating their spiritual life and commitments into the kind of their plan of care. It has a bigger umbrella that says, hey, where can we integrate and optimize all these different aspects of life to get more healing in the process for the patient and optimize their outcomes when maybe traditional medications can be helpful, but they don't suffice. Or for the patients that are maybe more medication hesitant, say, hey, how can we still serve them and work towards their health in a way that maybe respects their commitments if they, want to
Mhm.
try their modalities. And then the second part of your question was, I often get this question asked by friends or colleagues when I tell them what I do. Oh, what's the difference between a psychologist and a psychiatrist? First of all, we collaborate a lot together. There is some overlap in what we do, but traditionally, psychologists either earn a master's or a PhD in psychology. Some of them go purely the research route, so they work on studies, they teach in university or academic settings, and some of them never see patients. For the clinical psychologists, which is the one we do overlap with more, they do see patients. But one of the things they particularly specialize in very often is testing. Things like very, very comprehensive autism testing. There's also testing for things like ADHD, which if we're doing a full one, can be very long, and psychologists often specialize in that. Things like learning disabilities. Some of them subspecialize in kind of neurocognitive testing and kind of
Mhm.
geriatric psychology. And so what that looks like is working a lot with the elderly population, encompassing the whole area of the dementias. And then psychiatrists they're medical doctors, they're physicians. Largely, they get their MD or DO depending on where they graduate from, and they're trained principally as physicians, looking at a biomedical model, biological model as a basis, and then they subspecialize in the thoughts, moods, and behaviors.
Mhm.
There are some that work fully in research, so they come like research scientists, physician
Mhm.
scientists, and some of them don't see patients. They're kind of just working in the lab. Some of them fully see patients, and they could focus on different areas, kind of women's mental health, child and adolescence, forensics, kind of working
Mhm.
with justice adjacent area of medicine. On mood disorders can include depression, bipolar disorder. Some focus more on psychotic disorders, the schizophrenia kind of profile. Some focus on addictions, and so but that is all to say, it's psychiatrists and psychologists and various mental health professionals. They often collaborate.
I'm curious about, in terms of the patients that you treat, have you noticed any trends of complaints of why patients come to see you? Like, is there something that's different this year? Like, is there, in the last 5 years, has there been more anxiety? Are you seeing more depression and isolation? Like, have you noticed any trends or themes in the reasons why people seek your help?
Yeah, no, good question. There's a couple of things I notice. I think that for some people, there is maybe a sense of like, hey, this medicine was very helpful for me over the course of the last year or even decades in some cases. And I just kept getting prescribed it, but now it's kind of, I'm at a different stage of life and benefits are outweighing maybe the side effects, and I want to come off it. For example, several decades ago, one of the most highly prescribed medications, not only in the US, but also in Europe, was Valium.
Mhm.
Valium, the generic name is diazepam. It's a medicine that was prescribed for anxiety and sleep difficulties. Some people became dependent on it, and it was kind of a bit difficult for them to come off. But now, I think some of the patients that come to me, they're like, "Hey, I'm more attentive to potentially the risk of dependency, or maybe having to get tolerance and then get used to higher and higher doses. But there's a trade-off with that. I want to be in a situation where I'm not as dependent on this medicine, and my kids are getting older, for example, or I want to enjoy the kind of this retirement phase of life." And so people come kind of with those those concerns and inclinations. I think on average, what I'm seeing is motivated patients that, hey, I read this, or I read this, I'm kind of this potential side effect. How can I get to a good level, but with not being as dependent on too many different treatments? And so I
Mhm.
see that trend a bit more, kind of a motivated, um, well-intentioned patient.
It sounds as though maybe on some level, with accessibility to information too, patients are better informed. They'll do the research, or they'll read something on the internet, they'll see something on the news, when things come up, and God knows we all get all the advertising, when you're watching television, side effects may include da, 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 da. And so I think that gets a lot of people thinking, oh my God, what's gonna what's going to happen to me on this medication? But but in addition to that, I wonder if there isn't also more of a trend these days to think about mind body connection,
Mhm.
and how our health is affected by our mental health, our physical health is affected by our mental health, and vice versa. And things like exercise, diet, inflammation, those are pretty basic things, but we don't necessarily think of them in the context of how changes in lifestyle can actually improve your overall mood, your
Mhm.
emotional responses, the ability to kind of ground yourself.
Mhm.
That actually the body has some built-in biofeedback systems that you can use to help in those moments of distress. And I'm wondering if that's something that you get into with your patients.
Yeah, Laura, you actually touch on a great point. Absolutely. So, yes, I'd say that there is interest in those topics. I give one example. One of the things that I find fascinating is for the brain. You can think of exercise as fertilizer for the brain. So, for example, you and I both grew up in pretty cold places with cold winters.
Yes, 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 for sure. Yep.
And so, in the winter and colder climates, the trees are bare. The branches are just bare. There's no flowers. There's no leaves. And so we can think of the brain and neurons, which are kind of the basic unit of the brain, kind of like these branches and they connect to each other, as a tree in the winter. And what exercise does is it helps release in the body BDNF. So how it functions is it's you pour fertilizer on the brain on these branches and they blossom. So it's like spring,
Oh,
and the flowers come out, the leaves come out, and there's just more contact points on the tree. So similarly in the brain, there's more contact points. And so we're able to think more clearly. Our brain is just more connected. We're able to kind of make more rapid connections. And so in practice, what that looks like is like it's as if it were a treatment against anxiety, plus a treatment against depression, plus a treatment that improves our focus and attention. And so in a way that's, of course, it's natural, that has very, if
hmm.
no low side effects, right? There's always the risk of injury with exercise, the time, the volitional aspect, getting up, and of course, but generally it's almost free, right? Exercise is almost free. And
I'm really curious. Is it any kind of exercise, or is it aerobic versus weight training versus something else?
both forms have good evidence and their support, and there's always the debate like, hey, exactly how much time. I think a general understanding is that any exercise is better than none, and there's incremental benefits to a certain point, but general recommendations are about 150 minutes. So that would be like 30
Hmm.
minute sessions 5 days a week of moderate intensity exercise, kind of a safe kind of amount for most people. But yes, both strength training, both endurance training have good research for them. It's like you took a little bit of Prozac and a little bit of Ritalin, right? Instead of taking it, you do it in exercise. You take away the potential side effect profile of that medicine. Might not be that right medicine for a specific person based off their genetic biochemical makeup, but you also get that there's a point where you kind of get like almost a natural high, right? And so like if you go running and you hit the 20-minute, 30-minute mark, for some runners that kind of are way more intentional about it, they describe kind of this great feeling. And it's kind of all these chemicals being released in our body, healthy chemicals, other things like norepinephrine, dopamine, that don't explain everything, but they're a big part of that story, the kind of motivation, attention, mood. And so, yeah, I think there's more of interest and receptivity to say, how is it that exercise makes me feel good? But also, how can I function at the highest level and kind of have kind of optimal brain health so that I can
Mm.
not only perform professionally, but also, be more present for their families and their community, their friends. In particular for anxiety, I think we have so many good non-medication treatments. At the top, a lot of executives they have to have really good health regimens. They have to like to perform at a certain level, and many of them have personal trainers. And I always tell people any exercise is better than none, but if you could do it any time of the day, in particular against anxiety, I recommend it in the morning. And the reason I do is because it helps keep the brain more steady, right? And so you can think of a threshold, right? So if I'm an anxious person and there are things that make me nervous, well, I only need to get kind of to like 20% of my threshold if I don't do anything, if I don't exercise, to kind of get unsettled. But if I
Hmm.
do exercise, what I do is I activate the parasympathetic part of my nervous system, which is kind of the part that calms us down, the part that turns on when after we have a great meal or
Mm.
having like just relaxing at home. And so exercise, it activates that part. And so if I were to exercise in the morning, that 20% threshold that would be my baseline for getting nervous
Hmm.
without exercise now becomes, and this is just a relative number, that becomes 50%. So in other words,
Mm.
way more resilience. Things have to be way more intense to make me nervous, and that is, I think, for a lot of people, it is more motivating in the long term. And I think exercise is one common threshold that everyone can recognize as kind of okay, like there's good here, but why is it, right?
To hear that exercise is the number one medicine, I think is so important for people to know because, I, for example, as a therapist, can sit for 6 to 7 hours a day in a chair listening to people talk, and
Mhm.
then I hear that sitting is the new smoking, and I'm thinking, oh my God, I'm done for. But it is, it makes you feel so, well, I can only speak from my own experience, but I always feel much, much better, more grounded. And yes, like I can tolerate a whole lot more
Mhm. Mhm.
when I train in the morning versus the days that I don't. So I think that's a really important message. What about nutrition? I have had clients who have done the cleansing and they eliminate all kinds of food, and then when they get back onto it, or they start to introduce things back into their intake, they'll say, "Oh, I've been feeling a little bit more anxious," and it
Mhm.
can be. Often or sometimes directly related to maybe refined foods as opposed to whole and more natural foods. I wonder if you have any thoughts about that or if that's something
Yeah,
that's part of your
yeah,
practice.
of course, yeah. So nutrition is fascinating because it does highlight how biochemically unique every human person can be. Like, there are things that the body can make on its own, but they are essential. For example, vitamins and minerals that the body cannot produce, and it has to get from the outside. In order to get the optimum levels, hopefully, we are, eating the right food sources,
Hmm.
whether sources are getting kind of high quality supplementation intentionally, right? But we don't know. We don't know if we're eating everything we need to. In practice, what does it look like? And again, I'm not a reductionist. I don't reduce everything to neuroscience and biology because I think there's so many fascinating kind of higher level aspects of human behavior, human nature. But to the extent that biology can teach us about humans and neuroscience, I'm receptive to learning as much as I can because it's a big part of the story. So in the brain, there are neurotransmitters, or kind of little chemicals that make us feel different ways. And the body, it's like a kitchen, right? It's like to make a Caesar salad, if I'm missing the croutons or the Parmigiano Reggiano cheese, or I'm missing the Caesar dressing, I can't quite have that traditional Caesar salad. So each of those ingredients are things we have to get from the outside. And if I don't have enough of a folate, a vitamin B6, a vitamin B12, a vitamin D, I'm not going to produce the quality of salad that I should be producing. But the problem is that, sometimes it's easy to not eat well. We can easily kind of just go to work, commute back home, have like a sedentary lifestyle, and the easiest thing is just to get food that's quick, but it might not be kind of the most nutrient rich, dense food possible. And so very gentle over time, what happens is that we can have nutritional depletion. And the most common like suboptimal levels that I see, especially among patients in the US, I see low vitamin D. The vitamin D is actually a hormone. It's a bit of a misnomer. One of the ways to help activate it, is through sunlight. And
Yep.
so our vitamin D is low. It's very often correlated with depression. That's kind of one example. And then there's other ones, but Your question also got to kind of the question of maybe sensitivities and allergies. For some people, certain foods can affect kind of their mood and attention. And so some people might have particular sensitivity to dairy, for
Hmm.
example. And it's not until they remove it or they kind of tailor a diet specific that they see, like, oh, wow, my child is performing better at school because they can focus more, or I just don't feel as kind of irritable all the time. For difficult cases, there are things like the ketogenic diet, which is a more high fat diet, and fewer carbs, that for some people who have maybe have a hard time getting results in other areas, that can be an intervention that kind of improves their presentation. And for context, the ketogenic diet was kind of first used in medicine in a pediatric population that had seizures, epilepsy. And they noticed that the kids that were given that kind of diet, they had a reduction in the amount of seizures. And so there's just kind of so many new
Mm, I didn't
little
know that.
yeah, no, it's fascinating, and it's kind of it's a bit mind blowing, right? Because you think a diet, a specific kind of food regimen as medicine, like it is big picture integrative thinking
Hmm.
that I think is very attractive to not only clinicians like us, but also families, parents.
For sure, absolutely. I'm wondering about other forms of therapy
Mhm.
in terms of what you find works with clients. Like if you have a client who says, look, I'm open to supplements, but I really don't want to be on medication.
Yeah.
I'm thinking about some of this stuff is a little bit woo woo, but I'm thinking about things like Reiki, right? Energy.
Mhm.
I'm thinking about CBT, cognitive behavioral therapy, which
Yeah.
has been identified as, I guess, one of the premier forms of dealing with depression in terms of what can be measured. I might argue differently, but I think that it's largely identified as a pretty effective way of managing anxiety, depression, etc. I'm just wondering if you have any, other practices that you incorporate with your clients, like mindfulness, meditation. Maybe you recommend yoga, other elements into your therapy as an integrative practitioner.
So I always try to tailor it to kind of the patient where they're at and give their kind of their preferences and their commitments. So for patients that are part of religious and spiritual communities, there is really interesting strong research by Dr. Tyler Vanderweel. He's an epidemiologist. One of the studies is that found that over long-term period, those individuals attend religious services regularly. They tend to have lower levels of suicide, substance abuse, and depression. And so, for example, so if a patient comes to me like, "Hey, I'm part of this religious community. It's an important part of my life, my family's, but I'm really, really struggling with this substance or with alcohol." I'll share that study with them. For the right patient, it can be motivating. It can be really motivating. I'm always open to different forms of different therapeutics, right? If it works, I'm all for it. And so, for example, massage therapy, it's tricky, I think, with insurance coverage sometimes. But with that said, so for some people, it just works, and they say it's just they swear by it. There's some patients for whom like dance, like ballroom dance or partner dancing, like classical dancing, you release a lot of dopamine in activities like that. It's a very
Yeah.
healthy form of exercise. Plus, it has kind of this social element that much of other exercise doesn't. And for some people, it's kind of just like it just keeps them healthy because it keeps them engaged throughout life. It kind of expands their social network. But yeah, I'm always open to learning more. I don't know everything, and I'm always open to kind of new treatment modalities that could be helpful for patients.
Okay. I'm really always interested too on how trauma
Mhm.
affects mood, depression, how it affects the nervous system. Because, you know, I guess we all have some form of trauma, whether it's a small t or a big T. Trauma is largely also how someone defines, right? How someone reacts to an event,
Mhm.
which I think is an interesting or an experience, which is a different way of thinking of trauma. And so I'm curious about the relationship between trauma, the nervous system, and then how that gets presented, with anxiety and depression, getting back to some of the more familiar. I mean, I think a lot of us here we hear narcissism. We hear that's the term of the decade. Everybody's narcissistic, and then there is, you know, the anxiety and the depression and so on. But the actual, like, getting to the trauma, and I guess that integrative approach. Anyway, I'm using way too many words to ask my question, which is, what do you think that relationship is in terms of what you see come into your office?
I think it's fair to say no matter who you are, how much success one's had in one life, everyone has had disappointments in life and has had things that have marked them, right? Whether it's a rough death of a family member or a disappointment, illness. Every human has had potential trauma. Obviously, some much more severe and unjust than others. But I think there's an element where most people by adulthood can relate to kind of this topic. For some people, some of them can't quite let it go, right? They can't. It just stays with them, and they like perseverate. They think about it very often. It just scars them, right? Almost like it's kind of this imprint in their brain. And so what that looks like for some people is there might be certain reminders, right? Kind of like, oh, some like, this work environment, it's really bad, or this group of friends, or this person. What happens in the brain is that we have an alarm. Our alarm is called the amygdala. It's a funny name,
Yeah.
but the alarm. And that alarm is there, and it should be there, and it should only go off when appropriate. So for example, I'm by myself, got lost, I'm in a random city, took a wrong turn, I go down an alley at 2 a.m, and there's a group of 20 people approaching me, yelling at me, insulting me. That alarm should go off, right? As humans, like, we develop in such a way that that alarm should go off for the right reasons. And if it goes off then, and kind of, okay, I got to get out of here for my safety, it's working the right way. Good. But for people, many people, especially those, including those that have experienced trauma, that alarm fires more often than it should and in inappropriate moments that can subsequently cause problems. Think of like a kind of heights, for example. You're at a rooftop and the door shuts behind you, and you're kind of on the balcony and you can't quite get in. Your heart starts racing, your blood pressure goes up, you start sweating. Basically, that amygdala has already been firing and saying like, oh, this is kind of a threat. And by you trying to kind of come on in the room, you were telling the alarm that, hey, this is a problem. Yes, keep firing, this is a problem. If you were to kind of eventually be let back in and this were to happen again, the amygdala would fire even more fast next time. But instead, if what you did is like, okay, this is uncomfortable, but I'm going to stay outside. I'm just kind of try to breathe as well as I can. I'm saying, hey, this is a learning opportunity for me to teach the brain that this is uncomfortable, but it's not a threat. What it does is you're teaching the brain, is like, hey, I don't have to fire as much, right? Next time you get locked out, it'll fire, but it'll fire way less. Eventually, you get to a point where that alarm becomes extinct. With some patients, they're able to kind of shut down that alarm response. Some people, with the help of like benzos, what they do is they just shut down the alarm, right? So once the benzo effect comes off, the alarm's still going to fire, but it's
that's why people love benzos.
Yes,
because it just shuts everything down, and you're like, oh, this feels so good.
Yeah. Ideally, in the long term, yes. Ideally, we can kind of teach the brain kind of to not fire as much. And from a neuroscientific perspective, the goal is to make the prefrontal cortex stronger. That is to say, hey, make it kind of temper and dominate instead of the amygdala kind of calling the shots. And so sometimes that takes time, that takes attention for some people, but absolutely, trauma is very serious. Some people have suffered unjust suffering, but fortunately, I think that there have been enough hopeful cases and research and kind of people interested in this space where there's a lot of room for healing for a lot of people, even if it takes years. I think for the majority of cases, there's reason for hope.
Wow, that's really great news, because it's trauma can be, that kind of work can be the work of a lifetime, depending on the person, their resilience, and all the factors that go into recovery. It brings me to a question about psychedelics, because we're hearing more and more about the use of psychedelics in psychiatry. Now, I was a teenager in the 70s, so acid, quote unquote, mesk, also known as mescaline, mushrooms, all kinds of things. It was a dope smoking, hallucinogenic generation in Montreal in my day. So I'm really curious about, what your thoughts are in terms of psychedelics that has now been introduced into psychiatry by some practitioners.
One of the exciting things is that, for context, like, it is very difficult to study the brain in comparison to the heart, right, or the cardiovascular system, right? We know so many things about the heart. We can easily get blood samples, whereas to get a brain sample or to get cerebral spinal fluid, it's way more risky. It's super risky. So that's way too much. But also, even if we know things about their brain, we don't always know how that clinically applied, right? So we can learn a lot, but we can't translate from the bench, the scientific research bench, to the bedside, right, or the couch. With that said, compared to other fields, there are relatively fewer kind of innovations in psychiatry, but this field of psychedelics, as applied to potential treatments, is exciting because it represents a potential new breakthrough, or at least application towards clinical care in a specialty where it's just harder to have like major significant advances. And then the other part is that, we talk about kind of defenses, or it can take months or years of work for people to really, really open up and really to get to the heart of things, build that trust relationship in the context of therapy. One of the potential promises of psychedelics is that it can kind of accelerate therapy to the extent where you can really potentially start talking about the heart of the matter without potential reservation, without these defenses, in a way that just like accelerates therapy by potentially by year. So that's how some
Oh my
clinicians,
goodness.
that's how some, if that is a potential hope, right? You can just break down those defenses and just and get at the heart. There was a piece published in JAMA, which is one of the most selective, so Journal of the American Medical Association, one of the most selective journals to publish in the U.S. in medicine, and probably the world. And I interviewed some of the people involved with it and kind of experts in this area last summer. Researchers developed for this study an oral disintegrating form, an oral form of LSD, basically, and it was the first, in some ways, the first study to have not included talk therapy, but that had found that you can have reduction in anxiety sustained at the 3-month measure point from just a very small dose of LSD. And so that is potentially, I mean, there's potential promise. And now it's still kind of advancing. They're going to,
Mhm.
phase of trial because, in early stages you can get promising results, but then when you get to larger groups, it doesn't pan out. But so
Mhm.
that's there. So if something can be helpful to patients, I'm open to it. Technically, in the majority of the country, it's not an allowed treatment. All these things are kind of very
Mhm.
experimental research settings, and so I know there are some municipalities where there is a little more permissiveness in this area, but legally, outside research settings, it's technically very, very difficult
It's
for a
still,
physician.
yeah, it's still new territory, like so many other things, right?
And then, yeah, and then the other part is, I think with good reason and intention, these things, if they are to be approved, they're generally for clinical purposes under clinical supervision. I think there's always the potential risk for misinterpretation, as with other areas of, people see some of these studies, they're like, oh, well, I'll just use recreationally, right, outside the context of this. When I think so. I think in the long term, I mean, I don't know how this gets done from a policy perspective, but how do you bring out the best of therapeutic potential while also minimizing the risk for inappropriate abuse potentially, right?
Mhm.
And so but yeah, no, it's a potentially it can potentially be a very promising area. I'm always cautious, right? Because sometimes the research doesn't quite pan out, but it's an exciting area kind of to stay on top of. But yes, there is a lot of innovation research and funding going into this area as a potential um, other therapeutic for brain health.
All right. In closing, and I think that whole area of the hallucinogenics is something that we will see unfold. Here's a question for you, which is
Yeah,
a general one, but I think it's an important one.
yeah.
What can we all do to improve our mental health? Is there one thing in particular that we can do to improve our mental health?
So there's multiple things and perhaps multiple ways to answer that, but I think movement is one thing that's accessible to a lot of people that has good downstream implications for brain health, for mental health. And so whether it's the form of, for some people, jogging is it. For some people, playing pickleball.
Hmm.
For some people, it's dance. For some people, it's just going on walks. I think that's one of the best things because you don't think about it necessarily for mental health, but it is. You release so many good chemicals, if you will, in your body, and especially it's just very easier. We do a lot of remote work. We're in the US and we kind of can live often a very sedentary lifestyle. And we should also be very, very intentional about still giving our bodies the movement they need because, we, life looked very different centuries ago, right? We had to
That's
move around.
right.
That is one thing. And I think expressing gratitude is for many, many people very, very cathartic. So what I mean by that
Hmm.
is we're very lucky. I think most of your listeners are probably in North America, and so we're very lucky. Like we're in a very well resourced part of the world. Many of us have access to education, professional opportunities, and not everyone has that fortune. That social kind of educational economic opportunity. And so I think for a lot of healthy people that I've seen and mentors I've learned from, both within healthcare and outside of healthcare, they're very intentional about uh, thinking and reflecting on things to be grateful for maybe at the end of the day to themselves. I think that's a very, very healthy practice, right? Because we can often get caught up in our minds, kind of competition, just comparing the best to the best. But on the whole, for the majority of us, we have a roof over our heads, we're able to make a living, provide for our families, have an education, and still have recreation, right? Go to a game, right? Take a vacation with family, which is something that not everyone in the world has, unfortunately. And so I think that those little things can be very, very grounding and kind of can just put things into context in a way
Into
that,
perspective.
yeah. So those
Absolutely. I think there's also something about the practice of gratitude. You're right. It gives you perspective and it can be more of a focus to, oh my goodness, I'm all bent out of shape over this thing over here, but then I'm looking about all the things I'm grateful for and I think, wow, that wasn't so bad, and so it's a really good practice to employ. Well, I can't thank you enough for your time today. I know we've gone over, and I guess lastly, I want to ask, how can listeners find you if they would like to make an appointment with you or take a look at your website? How can they best do that?
yeah. So they can find me. They can go, Christian Monsalve, MD, but my practice is Very Great Health, and that's VERIGRATE, and the website is verigreat.com. And the origin of the name is kind of Veritas, truth and integration, kind of integrating truth into the person, truth of science and psychology and all these disciplines. And so yeah, I'm happy to be a resource, but also I have trusted colleagues all over the country. So depending on where listeners are, I'm happy to recommend trusted colleagues all over the country who might be appropriate when so. And Laurie, it was so delightful to get to chat with you. I'm so happy that we got to spend this time together, and I look forward to staying in
Yes.
touch. Yeah,
Thank you
congrats.
very, very much. I know our listeners will enjoy learning more about psychiatry and how you approach it and the importance of overall good health and the connection between mind and body. Very, very important stuff. So thank you so much for your time today.
It was a delight, Laurie. Take
Thank
care.
you. Bye
Thanks.
bye.
The Montfort Group aims to provide a serene, calming setting where you can feel challenged, supported, and motivated. Our skilled therapists bridge specialized backgrounds and varied philosophies together to create one unified strategy. Rather than steer you away from your own natural abilities, we help you maximize your unique strengths to uncover the boldest version of yourself. We do not view a broken history as the end of a story. We see it as an opportunity for a new beginning. To learn more about our practice and how we can help you, please visit us at themontfortgroup.com.